As you are all aware, we've been doing a series on lupus, and today we're going to talk about managing lupus complications. And we're talking with Dr. Pradip Kumar Sarma, who's the rheumatologist and clinical immunologist based in Guwahati. And we'll do a quick introduction just right away. Patients Engage is an online platform, as some of you are already aware. We strongly believe that patients who are and their family caregivers, if they are better informed about their condition and they're proactive about it, that leads to better decision making, and you will be able to deal with the complications and understand what you need to do better. And that's what's the objective of Patients Engage, to bring together experts as well as people with lived experiences. Um, some of you may be aware that we had done a session about 2 weeks ago on the basics of lupus, and this was largely in Hindi. So if that's what you're looking for, you can go and check our YouTube channel or our Facebook page to find that recording as well. And today, as I said, we are very privileged to have with us Dr. Pradip Kumar Sarma, who's a rheumatologist and clinical immunologist. He's currently HOD rheumatology department at Excel Care Hospital in Guwahati. And he's the secretary of the Assam chapter of the Indian Rheumatology Association. He comes from a strong background of he's done his MBBS and MD. He's done his DM in rheumatology from Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. Received a fellowship from the Japan College of Rheumatology in 2007, and he's had many publications, and he's also the ex-member of the editorial board of International Journal of Rheumatic Diseases. So again, thank you, doctor, for making the time to join us. Again, as always, a guidance to our attendees that, this is not replacing your consultations, medical consultations. This is general advice, and you can definitely ask your questions, and we will, if it's generic information, we will provide that. But if it is specific, then we would request you to get in touch with the Dr. Sarma separately as well, or your own doctor for specific medical issues. This session is being recorded, and it will be uploaded on YouTube as well. And if you're logged into Zoom, you can post your questions on the Q&A. If you're on Facebook or YouTube, you can post them on the live feed. And as always, you can write to us at editor@patientsengage.com. And, we will be doing this as part of a series. So there's 3 more in the series that are coming up. So follow us on our social media pages. We are on Instagram, we are on Facebook, Twitter, as well as YouTube. So let me stop the share and let's get started, because we have a lot to cover today. So doctor, thank you once again for joining. And if you can quickly recap for our audience, what is lupus, so that people are all on the same page.
Yeah, good afternoon, everyone. Thank you for your nice introduction about me. So lupus actually, or what we call as systemic lupus erythematosus, is a complex disease for us doctors also, because nowadays it is called that if you know lupus or systemic lupus erythematosus, you know whole medicine, because lupus can involve any organ system of the body. It can affect the hair, it can affect the skin, it can affect the oral cavity, it can affect the heart, kidney, joints. So every organ system can be involved. So if you know lupus, you know medicine. Such a complex disease. So basically what happens during Corona time, now everybody will be knowing about immunity. So we have an immune system which protects our body from various infections like bacteria, fungus, or viruses, as well as cancers. So normally this immune system recognizes our body's tissues or cells or whatever we call it. So they don't attack our own system. But in some diseases like say lupus or other autoimmune diseases, so what happens, our immune system starts attacking our own tissues. So why this happens, nobody knows the exact answer. But that's why it is called as autoimmune disease. And that's why we see in lupus lots of antibody. So commonly everyone will be knowing anti-nuclear antibody. So that test basically is an antibody. And we see lots of various antibodies. So lupus is in a nutshell, it is an autoimmune disease which can affect every organ of the body.
Thank you, doctor. And for people who may not already be diagnosed with lupus, what are some of the signs and symptoms that they should watch out for?
Yeah. So everybody's actually lupus is totally different. So every patient's presents differently. Some patients have minor problems like some mild degree of fever, some arthralgias, some hair loss, some skin problems. Or some people have severe problems like kidney problems or heart problems or problems of the nerves or the brain. So everybody's lupus is different. But when, say, you have fever, you have joint pain, you have some skin manifestations, some swelling in the legs, so and some non headache which is not responding to any medications. So along with these things, usually what we say that fever along with other any other organ system, or no fever but two organs are involved, then usually we think about lupus. But one thing I want to highlight is that even if a patient is diagnosed as lupus, most of the patients panic, oh, I have lupus, because nowadays they search in the internet, and internet, most of the things they look at, actually they become panicky. So once you are diagnosed with lupus, you need not panic, because everybody's lupus is different. Somebody has only joint problems and fever, somebody has skin problems only, and even if you have severe problems also, treatments are available nowadays, and most of the patients actually with treatment they could. So everybody's lupus is different, but symptoms like joint pain, then mild degree of fever, some skin rashes, some cough which is going on for a long time, some chest pain which is going on for a long time. So these symptoms should not be ignored.
Right, right. And is lupus typically diagnosed by eliminating other conditions, or there is any specific tests for lupus?
Yeah, that is a very important question actually. So to diagnose lupus, we do what we call as anti-nuclear antibody. So again, some symptoms, say some fever, mere ANA positivity is not equivalent to lupus. ANA, anti-nuclear antibody, can be positive in so many conditions. Even in infections, like the patient has a heart problem, what we call bacterial endocarditis, that is an infection of the heart. So those patients will also have joint pain. Those patients will also have fever. They have some manifestation in the hands also. So typically it looks like lupus, but that patient is suffering from an infection of the heart. So mere ANA positivity along with some symptoms is not lupus. So
Right.
we actually for lupus we need some clinical features. So and this American College of Rheumatology, they have a classification criteria. Though in the bedside you need not follow the classification criteria, but at least that is a starting point for us. So, but to diagnose lupus, most of the time we do anti-nuclear antibody. And nowadays we do it by immunofluorescence. Antibody, again, anti-nuclear antibody can be done by ELISA or immunofluorescence. So
Right.
ELISA it can be actually fallacious. So most of the time we don't do by ELISA nowadays. We do by immunofluorescence.
Right.
So again, ANA positive along with features which are specific to SLA, like say in blood we see total leukocyte count.
Right.
So in SLA, in infection, usually total leukocyte count goes up in any kind of bacterial infections. But in case of lupus, usually that total leukocyte count goes down. Like say another simple test we do is platelet count. So again, platelet count may be low in case of lupus. So if a patient present with fever and joint pain along with say some decrease in the total leukocyte count, some borderline platelet count is low, then urine is showing some abnormality. So then if you do anti-nuclear antibody, if it is positive, then we label it as systemic lupus erythematosus. So we do the test, anti-nuclear antibody, to diagnose it. If it is negative, then most likely it is not lupus with the current test we do.
Right, right. Thank you. Thank you, doctor. And just for those of you who've joined in late, we are talking to Dr. Pradip Kumar Sarma, who is a rheumatologist and clinical immunologist, and we are talking about lupus complications today. And this webinar is being sponsored by Biocon Biologics. And if you are watching and if you have questions, you can ask them on the social media feeds of Facebook and YouTube, and we will address them. And so, Doctor, you said that lupus patient, each one is different. So what is the prognosis for lupus? So once you get diagnosed, what's going to happen? Because sometimes people get, as you said, you should not worry, but people are worried about what will happen to them, even if it's not happening right now. So what's the prognosis, and is it the same for everyone?
No, prognosis is totally different for everyone patients. So some people have only minor organ problems. Say as we have discussed already, some people have only arthritis, skin problems, then hair problems along with mild degree of fever. Those patients actually, their prognosis is very good actually. Their survival is like any other people without SLA. But even with major organ problems, if you look at what the prognosis was, say, in 1950s and 60s, and what is the prognosis now, there is a huge difference. Say, in 1950s, if a patient has SLE with major organ involvement, the 5-year survival was around hardly 50%, 40%, 50%. But nowadays, we don't talk even 5-year survival. We talk about 15-year survival. So even with current treatment, even with major organ involvements, the survival is more than 80%. So even with major organ and minor organ, it is almost like a normal people.
Right, right. So let us, what are some of the common complications that are common for lupus patients?
So common, say, as we have discussed, lupus can affect every
Any
organ.
or
Yeah, so it can have problems in the complications in the kidney, it can have complications in the heart, it can have complications in the nervous system like brain or peripheral nervous system, it can have complications in the bones and musculoskeletal system, and even it can have complications in the skin also. So every patient's problem is different. So complications also depend upon what are the organs involved in the particular patient.
so if you look at some of the common ones, for instance, people often talk about things like lupus nephritis, or they talk
Yeah.
about heart issues. So are these some of the more common issues or the more complicated issues?
Yeah. So say one of the common problem in lupus we face is the involvement of the kidney. Around half of the patient, more than half of the patient, will have problem in the kidneys. So and usually when we suspect that this patient have kidney problems, when patient have some swelling in the legs, some undue fatigueness, then hemoglobin is going down, then blood pressure is going up. So these are some of the features when we suspect that patient may have kidney problem. And usually most important investigation in case of lupus is the urine routine examination. So if a patient has kidney involvement, usually urine will show something like, say, there will be albumin will be positive, then it may
Right.
show RBCs, WBCs, it may show cast. So when patient has these kind of problems, usually we advise the patient to do a kidney biopsy. So when
Right.
we talk about biopsy, again, patients become panicky. So that becomes a problem. So to everyone, I want to tell the kidney biopsy is not like, say, biopsy for what we tell they are suspecting cancer. When people talk about biopsy, the first thing they are the doctor, is the doctor thinking about cancer. So
Correct.
biopsy does not mean we are looking at cancers. Basically, again, kidney involvement, there are different types in lupus. So in medical terms, we call is as 6 classes of lupus nephritis is there. So every class has different treatment. So that's why we want to be sure what class the patient has. And
Right.
biopsy is not a cumbersome procedure. It basically done this ultrasound guided. Basically, it is done with a needle. So
Right.
it is not like something will be cut or something like that. So basically, a needle is used to get a tissue from the kidney. So depending upon which type of nephritis the patient has, kidney problem the patient has, that actually guides our treatment. So, and ultimately, most of the patients respond to this treatment. And
Right.
a long term, say, if we treat properly,
Mm.
the response rate is more than 90%. So
Right.
10% patients ultimately probably won't response. They end up in chronic kidney disease. So
Mm.
that is the complication we call as, if you, in pure terms, what will be the complication? If we treat properly, 90% patients with kidney problems will be having a normal life. But
Right.
if you don't treat properly, ultimate complication is chronic kidney failure. So
Right.
chronic kidney failure, all with all those requirement of dialysis, ultimately patient may require a kidney transplant.
Mm.
So that's why we have to detect the kidney, the problem early,
Right.
and we have to treat it properly.
Right. Right.
Yeah,
So, what is the, I know you said you do urine test, for instance,
yeah,
regularly. How often do you recommend patients of, your patients to come and see you and to do the necessary testing? Is that
yeah.
fixed for all patients? Is there a standard protocol, or does that again depend?
It again depends upon the patient's condition.
Mm.
So how the patient's initial presentation is. What there are different tests, like say we do some antibodies to see the disease activity, like say DS, double stranded DNA, C3, C4. These are some of the tests, immunological tests we do. So depending upon this test, it actually decides how frequently patient has to be monitored. But usually, at least every 3 months, usually we do the routine investigations, like say hemoglobin, then total leukocyte count, platelet count, urinary, creatinine. These are the tests required at least every 3 to 4 months in most of the patients of SLE.
Right, right. Okay. So you talked of kidney, you also talked of briefly, you mentioned about monitoring blood pressure, etc. But is
Yeah,
heart organ that gets affected
yeah,
with lupus?
yeah. So heart actually, uh, again, all the layers of the heart, actually heart has many layers.
Mm.
So again, all the layers of the heart can be affected in lupus. Say outside the heart, we have a sac. We call it as pericardium. That is a membrane-like thing. So it the SLA can affect that part also. So what we call as pericarditis. If the pericardium is involved, that sac is involved, then those patients usually will manifest as chest pain that increases with respiration, breathing. So there may be difficulty in breathing. But that is not a major problem. That usually problem goes with low dose of steroid, hydroxychloroquine, and even NSAIDs, like what we commonly call as painkiller. So major problem is when the SLE involves the muscles of the heart. So heart has muscles to pump blood. So those muscles can be involved. When it is involved, we call is that myocarditis. So if myocarditis is there, those patients require usually high dose of steroid, and along with that, immunosuppressions are required. Then we have valves in the heart. So those valves can be also affected in lupus. Especially along with lupus, we have one condition called Antiphospholipid Syndrome, where blood spontaneously gets clotted. So if that is there, then patients can have involvement of the valve also. So those are manifestations of lupus. But if we talk about complications, so complication in the long term, what we fear is atherosclerosis, what they probably, whether people will understand or not. So
Mm.
people will understand heart attack commonly.
Right, right.
So like in medical terms, we call this as myocardial infarction or angina. So those heart attacks.
Mm.
So that is an interesting thing actually. I want to elaborate that.
Mm.
So in SLE patients, how ultimately, why we fear, how patients ultimately, what is the
Doctor,
most
can you
actually
lift your
scary?
phone a little bit? Your face is getting cut a
Okay,
little
okay,
bit. Yeah, yeah.
okay.
Thank you.
So what we fear actually in SLE is the complications, like say infection. It is very common in SLE. So
Mm.
next problem is that atherosclerosis, what I am
Mm.
telling you. So most of the people actually die because of these two complications in SLE. So apart from infection, next common thing is atherosclerosis.
Right.
Interestingly, atherosclerosis, and most of the SLE patients are actually young female. If you see,
Correct. Exactly.
female to male ratio is around 15:1 in
Yes.
this young age.
Yes.
And most of the affected female are in between 15 to 45 years of age.
Mm.
Interestingly, in 15 to 45 years of age, atherosclerosis is not very common. Heart attack
Mm.
is very rare in this group of female. Male can suffer at 40, but
Mm.
female usually don't suffer heart attack at this young age. But in
Right.
SLE, there that is the risk of this heart attack is increased by around 50-fold.
Right.
So that is the complication we fear. So that's why, and disease controlling disease activity is very, very important so that long term this complication does not occur.
Right.
And most of the thing you will, I have already mentioned, most of the this manifestations they require steroid. That steroid is a double-edged sword.
Mm.
Steroid can lead to more atherosclerosis.
Right.
So drugs along with the disease activity, these two are important for atherosclerosis. So that's why we have to evaluate these patients for these risks of this kind of complications like heart failure or stroke in the brain.
Right.
Or so that's why we usually they need some follow-up. Then whether they have other risk factor, common risk factors for heart attack or not. It's like
Mm.
say lipid abnormalities. Those are
Right.
usually risk factor for heart attack, like
Right.
smoking, like obesity, sedentary habits. So we SLE patients usually they can also have those risk factors. So
Mm.
usually that's why we want to address those issues.
Right.
And along with that, we want to control disease activity also, because disease activity itself is a risk factor for increased heart failure or stroke. So
Right.
that's why we have to look at the disease activity along with this modifiable risk factors, all these factors. So we usually we look at that also. And if we control these factors, along with if we control lupus disease activity, the risks of atherosclerosis or heart failure or strokes become lower.
So when you talk of control risk factors, what are the things that you advise patients to do?
Yeah. So that is again an important question that everyone with lupus should do. So as I already, as we have discussed, so risks of this heart attack and stroke is increased by many fold. It is
Mm.
at this age it is increased by 50-fold. That's why
Right.
it is very important they should look at their diet.
Mm.
So because lipid abnormalities are again those are increased risk factor for this heart attack and stroke. So
Mm.
they should have always a balanced diet, and their fats and carbohydrates should be limited. They can Most of the people actually think that protein is bad for any kind of arteries. Protein is not bad. It is the carbohydrates and the fats.
Right.
Junk food, what we call is those are bad for this kind of patients. Regular exercise, that is very, very important to
Mm.
prevent these complications. Then regular look at this measuring the blood pressure and sugar,
Mm.
because we most of these lupus patients will be on steroids. So those are
Correct.
again risk factor for blood pressure and
Diabetes and
diabetes.
right.
So regular
Right.
monitoring of blood sugar and blood pressure is very, very important.
Right.
And then stress, that is
Mm.
an important factor. So as you have actually mentioned earlier, is panicky situation. That stress, that
Mm.
again a risk factor. They should not see disease. I always tell my patient, you have a disease that is nobody's fault, and nobody knows who is going to suffer.
Mm.
Tomorrow, I myself can suffer from lupus. Nobody knows. So
Right.
that cannot be modified. What we can modify is response to that disease, what we are thinking about the disease.
Mm.
So it is like treatment is available. So why should we take stress?
Right.
So
Right.
minimalizing this stress is very, very important. And most important is regular exercise. That is a must for
Right.
everyone. It is
Right.
not only for the heart or the brain, as as we will be discussing, for the joints, for the
Mm.
bones.
Right.
So exercise, it is probably 10, 15 years back, there is an article in that is New England Journal of Medicine. That is like the Bible for our medicine people. So
Mm.
there was an article. So exercise is told to be the magic pill.
Correct. Correct. Correct.
So everyone should do exercise, and it is very, very important for lupus patients also to do exercise regularly.
Yeah, I think one of the things that's the big change that has happened in the last few years, right? In the past, if you were unwell, you stopped exercising. But now I
Yeah,
think there is this whole recognition that if you exercise, it's actually good for your,
yeah,
even if you have pain, and even if you have, as much as possible, you should find ways to exercise.
yeah, yeah, yeah.
You mentioned bone and joints. Can you talk a little bit more about the complications on bone and joints?
Yeah. So another manifestation of lupus is the pains, joint pain, so commonly. So that is a manifestation. But say unlike rheumatoid arthritis, so what happens in rheumatoid arthritis, we call it as erosive disease. There is erosions in the joints. So don't go by the medical term. So what erosions actually important? Why erosions are important? If we have erosions in our joints, that ultimately leads to deformities. So the joint damage occur. But fortunately, in lupus, patient can have arthritis, but they don't have those kind of erosions that we see in rheumatoid arthritis. So that's why most of these arthritis, they are usually non-deforming. So deformity does not occur. Some deformities can occur, but those are basically reversible deformities because those occurs because of the laxity of the ligaments. But usually joints, they don't get damaged like that of rheumatoid arthritis or ankylosing spondylitis. Then muscles can be involved. So patient can have mild pain in the muscles, and sometimes they can have myositis also. That means that leads to weakness of the muscles. We have one disease called myositis, dermatomyositis or polymyositis. So some patients can have these manifestations like myositis when along with muscle pain, they will have muscle weakness, especially the proximal muscles. They have difficulty in lifting their arms, like they get difficulty in combing their hairs. So they have weakness of the proximal lower limbs also. So that's why get difficulty in standing from sitting positions. So, but that is not very common. But one thing, long-term complication, what we see is osteoporosis.
Right,
It is because of the steroids or because of the disease itself. So,
right.
in some studies, actually, it has been shown that one third of the patients have osteopenia, that means weak bones,
Mm,
and around 15 to 20% patients have osteoporosis. And we have to remember these patients are very, very young. It's
mm,
not elderly. Osteoporosis is more common in elderly,
correct,
but
correct.
young people can also have osteoporosis if they have lupus. So that is one complications we see, osteoporosis and these weak bones, what
Mm,
we call osteopenia, and
right,
that can lead to fractures.
right.
Another peculiar thing we see is what we call as avascular necrosis.
Mm,
That means blood supply to the these bones becomes less, and
right.
that commonly affected area is hip joints,
Mm,
and sometimes knee joints and other joints can be affected. But more common
hip,
is the hip joints that we
right.
call as avascular necrosis. So why it happens? It is particularly it occurs in a SLE, but why it happens we don't know
Mm,
exactly. And what is the treatment also? Exact treatment also it is not known, but some people ultimately needs hip joints surgery for this avascular necrosis.
okay. And is there anything that, again, people can do to prevent this? And, does this happen quite rapidly, the effect on bones?
Yeah, because actually, uh, because of the disease itself, and we will be using lots of steroids. So
Right.
that's why usually this bone loss becomes very early in case of SLE. So one important factor to prevent this osteoporosis is exercise,
Mm,
and especially weight bearing exercises.
right.
At least if people can do 2-3 times a week weight bearing exercises. That is good for bones.
Mm,
Then regular this intake of calcium and vitamin D.
right.
So calcium, we can get lots of calcium in milk and this fish.
Mm,
So then meat. So regular calcium and vitamin D, regular
right.
exercise. So those are very, very important for this preventing this osteoporosis.
Okay. And you talked about some of these, like you talked of the effects of steroid. Somebody's asked a question His daughter is on, I think, Renodapt for 7 years. He's asking if that can cause any complications.
So Renodept again is an important drug for that is basically mycophenolate sodium. So what actually it is given for major organ manifestations when patients have kidney problem or problems in the nervous system or problems in the heart, usually that is given. So sometimes long term it has to be used, but we have to monitor. If monitored properly, say again those common tests like hemoglobin total, because these are the with mycophenolate hemoglobin may come down, total leukocyte count may come down, platelet may come down, and
Right.
it can create problem in the liver. So regular monitoring of this SGOT, SGPT. So if we monitor this properly, then it should not cause a problem.
Right. Okay. And I think you've anyway talked of the managing lifestyle, controlling risk factors by exercising, by diet, etc. But on diet, sometimes people try all kinds of other diets as well these days, right? They try elimination diets, etc. Is there any evidence on any of those dietary interventions?
Yeah, actually, that is a very, very good question. Nowadays, most of the actually people are, whoever has any kind of pain, they will ask what diet I should take. So there are many things found in the internet, but actually most of the things are they are actually not peer reviewed, so that's not proper. There is actually no specific diet for SLE or any kind of arthritis, except people who has problem with uric acid. Apart from that, in any kind of arthritis, there is no specific diet. Most important is to have a balanced diet. And balanced diet, and now it is very important to cut down the fats and the carbohydrates, to take more protein, more vegetables, and more fruits. So fruits are very, very important. Vegetables are very, very important. And importantly, we should have a balanced diet. But there is no specific diet. We should not go by this internet knowledge. So should have a balanced diet with more vegetables, more proteins, more fruits.
Right, right. Okay. And in terms of, you also talked of the fact that lupus affects younger people more, and obviously that means that it affects, and you said young women as well. So one of the commonest questions we get and people struggle with is about pregnancy in lupus, right? So, can p- persons or women with lupus become pregnant? And if yes, how should they go about it?
Yeah, definitely. That is a common problem because it affects the younger people, as you have already mentioned. So definitely, diagnosis of lupus is not the end of the road. So most of the people can have a normal life. Even pregnancy can be it is usually most of the time if we plan it properly, pregnancy is always uneventful. Patient can have a normal baby. And the first question whether I have lupus, my daughter or my son will have also, whether they have the risks or not. So actually, nobody can answer that question. If a family member have SLE, then the risks of SLE is somewhat increased. But it is not like that I have SLE means my daughter or son will also have SLE. So pregnancy can be always planned in lupus, but it should be planned. It cannot be haphazard. Some patients cannot actually plan pregnancy, like say a heart condition we call as pulmonary hypertension. And if the patient has chronic kidney disease, if the patient has interstitial lung disease. So in these conditions, usually we don't advise to go for pregnancy because that can lead to complications. Otherwise, if these conditions are not there, then usually people can have a planned pregnancy. But what we want is before pregnancy is planned, there should not be any disease activity. Patient should be in what we term it as remission. So disease totally should be under control, at least for 6 months. Then only the patients can plan pregnancy. And during pregnancy also frequent monitoring is required because, see, it affects the females more. So why it affects the female more, we don't know. But hormones are definitely maybe a factor. And
Right.
see, pregnancy, all those estrogen, this prolactin, progesterone, those are increased. So when
Right.
the patients become pregnant, there is the risk of flare always.
Hmm.
So that's
Hmm.
why frequent monitoring is important, and that's why it is very, very important that patient's disease should be under control at least for 6 months. Then only pregnancy should be planned. And
Right.
some medications, like one patient asks about Renode, some medications cannot be given during pregnancy, like
Hmm.
those mycophenolate or yeah, the cyclosamide. So those things, methotrexate, these drugs cannot be given during pregnancy. So
Right.
some drugs are safe, like say low dose prednisolone, say less than 10 milligram, azathioprine, hydroxychloroquine, then sulfasalazine, then tacrolimus, cyclosporin. There are so many drugs which are actually compatible with pregnancy. So that's
Hmm.
why proper planning. So we have to
Right.
say when the patient is in remission, we sense that patient is already say on mycophenolate, we usually try to send it to azathioprine. Then we see how whether patient is responding to that medicine or not. If
Right.
he is okay with these new medicines also, then only we advise to go for pregnancy.
Right. Okay. We have a question. So, lupus sometimes causes extreme hair fall. So, can that be reversed, especially when on steroids?
No, actually, it does hair fall most of the time. It is not because of steroid.
Hmm.
So actually, steroid reverses it, the hair
Right.
fall. So
Right.
most of the time that lupus hair fall is because of the disease activity itself, because of the disease itself. So
Right.
with treatment, most of the time, the usually it and that hair loss is not permanent.
Okay.
So most of the time, except in one condition, we call this as discoid lupus, when the patients actually in the skull, they
Right.
have disc-like lesions.
Right.
So some red or black or white. So disc-like lesion in the scalp. So
Hmm.
that usually scars. There is a scar usually,
Right.
and that is not actually whole scalp is not affected.
Hmm.
Part is affected. So when the patient has that discoid lesions, then only the hair loss is permanent. Otherwise, most of the time, the hair loss it is reversible because there is no scarring. So with
Right.
treatment, when the disease because it occurs because of the disease activity. When we
Right.
control the disease activity, usually the this hair comes back.
Right. Right.
But
Right.
interestingly, one thing I have found is that so it actually this hair fall it reverses last.
Hmm.
Most of the major problems they actually disappear, but the hairs to appear they usually takes time.
Right. Right. Okay. So one other question, I guess at the moment everybody has this question on uh, can lupus patients take COVID vaccine?
Definitely yes, they should take it because they will be on these drugs, so they are more prone to have any kind of infection, though it has not been shown. So
Hmm.
definitely they should take vaccine. Everyone should take vaccine. One few precautions to be taken during vaccine. Say steroid we are discussing. If the patient is on high dose steroid, usually if it is more than 20 milligram or something like the equivalent of prednisolone,
Hmm.
usually we defer it till
Hmm.
the steroid because anyway we will cut down the steroids. So usually we ask them to wait till the steroid dose is less than 20 milligram or so. Then
Right.
only we advise them to take EA. Then if the patient is on endoxan, usually that is given in monthly injections.
Hmm.
If the patient is on endoxan, usually we ask them to take the vaccine in between two endoxan. Say it is given monthly. So we ask them to take the vaccine in between two injections.
Right.
So say 15 days after the first injection, 15 days before the second injections. Then if the patient is on methotrexate, then usually we ask the patients to skip methotrexate for 1 week after taking the vaccines.
Right.
Then other medicines they can continue like that. So, but vaccine definitely everyone should take it.
Right. Right. Okay. And do you you just tell patients whichever vaccine, or is there any advisory on that?
No, whichever vaccine they want to take, they can take it.
Right. Right. And should they be so before they take the vaccine, they should contact their rheumatologist a week before, 2 weeks before? How do they ascertain when is a good time?
Yeah, basically before taking the vaccine, it is always good to talk to the doctor
Hmm.
before taking the vaccine because as I already told you,
Right.
Prednisolone, if the dose is high, so if they take the vaccine also, that won't be effective. So it
Right.
is always better to, they can consult at any time, even
Right.
before, one day before also, if they consult, it is fine.
Okay.
But they should ask their consultant about that vaccine before taking it.
Okay. Okay. Does the question that's come is lupus a genetic condition?
That part actually we touched before also. So yes, it is genetic, somewhat genetic. Say it is thought that 50% risk is genetic
Mm,
and 50% is environmental, but it is not because of one gene.
mm,
So many genes are involved. So that's why, say, if a patient have any family members of SLE, then risk of not only for SLE, for other autoimmune diseases also, risk is a bit higher than the general populations.
right.
But it is not like some, say, when we call it a monogenetic disorder, say when the defect is only in the one gene, then the risk in the family is very high. But these are polygenetics, we call as, so many genes are involved. So risk is there, it is, but it is not that great. So it is genes 50%, but 50% is environmental.
Right. Right. Okay. Somebody's also said that asked whether they get stiffness in their fingers in the morning. Is that related to lupus?
It can be, it definitely, because so stiffness is a actually sign of arthritis, ongoing arthritis.
Right.
Because most of the time, this when we have arthritis in the rheumatoid or SLE or ankylosing spondylitis, the maximum actually pain occurs in the morning. So if a patient has stiffness in the morning, I think better to consult to the doctor, because that may need modification of the treatment.
Right. Right. Again, on I think somebody's asked a follow-up question on pregnancy is how you said you need to plan it. How much time does this planning take? So how when should they start this planning process? Is it 6 months? Is it 9 months? Is it
Yeah.
12 months? What's the
So
duration? I
no,
know
see,
it's tricky with pregnancy, but
no, lupus is not like that. It is 6 months or 9 months, something like. But lupus patients, they have to be under a rheumatologist, so at any time. So what I actually emphasize is that when they can plan pregnancy. So pregnancy is, it is they can plan when the disease is under control for 6 months. So then they can plan pregnancy, but be, that has to be decided by the consultant as well by the patient. Sometimes the patient is nearing 40, sometimes it happens. Then patient also has active disease. They uh, need a baby. So in those tough situations, so we have to decide, because see, they, some patients actually desperately they want a baby, but you have to think about the lupus also, because you have a disease which, if it is not under control, if you become pregnant, it is high chance that disease will be more active during pregnancy.
Mm,
So then if the disease comes back, then pregnancy once cannot be continued. Then
mm,
there will be risks for the mother also. So that's why it is very, very important that the lupus is under control at least for 6 months. Then only they can plan pregnancy. But
right.
when the planning, actually it is this planning of treatment is a continuous process. So
Mm,
every lupus patient should be always under a rheumatologist. Then that rheumatologist can guide you. So okay, if you want pregnancy, okay, this is the best time.
mm, right. And in terms of pregnancy, are they? Is it possible for them to take, help like IUI, IVF, etc., or those are not?
Yeah. They
They
can
can.
plan for IVF also,
Okay.
IUI also. There is no
Okay.
problem with that.
Okay. Okay. Um, all right. So, any other complications that you would want to, highlight to our audience, doctor?
So probably we have not discussed about two systems. Probably one is the nervous system, one is the lung. So lupus can actually affect the nervous system, whole nervous system, like brain, the spinal cord, the nerves of this periphery, like hands or fingers. So headache is a common problem in lupus patients. More than half of the patients have headache. Exactly, we cannot pinpoint what is a headache. Then another peculiar manifestation of lupus is this fatigue. And even some patients, even with treatment, that fatigue actually doesn't go. So
Right.
when usually we advise our patients when that happens, usually we ask the patients at least whenever you feel fatigue, at least during daytime, take a nap. At least if it is for half an hour also, that will also actually helpful for it.
Mm.
So fatigue, even with treatment, sometimes it does not go. Then this concentration, problem with the concentration, that is also why it happens. No, if you do one MRI, there is nothing. But sometimes some people actually feels problem with concentration. If it is happening, don't panic it. Gradually it goes off. But remember, this problem with concentration, it is not only because of the lupus disease itself, because of the stress also people have problem.
Correct. Correct.
So
Correct.
if you have problem with the concentration, then always try to do some yoga, some meditation, try to reduce your stress. These are the common minor problems, but major problems can also occur. Like say sometimes we see stroke in young.
Mm.
Stroke in young people, usually one cause can be SLE and that antiphospholipid syndrome. Then some patients have psychiatric problems. So psychiatric problems don't sometimes can be manifestation of lupus also. So remember, all psychiatric patients are not only should go to the psychiatrist. Some
True.
patients can have SLE problems also. So
Mm.
say psychiatric problem along with joint pain, along with some fever, some skin problem, some urine problem. Think about lupus. So psychiatric problems can occur, then stroke can occur, then infections like
Mm.
meningitis or encephalitis. Those
Right.
things can also occur in lupus.
Right.
So stroke, again, those atherosclerosis we have discussed. So that can lead to again stroke. SLE itself can lead to stroke. Antiphospholipid syndrome can lead to strokes. So these are some of the common neurological problems. So in the lung also there can be complications. So
Mm.
common is that there is a like we have a sac in the heart. So we have a sac like mammal like thing around the lung also. So
Right.
when that is called, we call this as that is called as pleura. So there can be there can be this. There is usually two layers. So in between two layers, if that layer is affected, that pleura is affected, there can be fluid in between these layers. So
Mm.
pleural effusion, most common cause in our country is tuberculosis.
Right.
But usually we have two lungs. If both side there is fluid, we think about diseases like SLA. So
Mm.
if it is one-sided fluid is there, usually we think about infections like tuberculosis.
Right.
So if both side is there, then usually it can be lupus, it can be rheumatoid arthritis. Usually you think like that way. So there can be infections. Infection is common. Pneumonia is common in the community. So
Mm.
SLE patients are also prone to these pneumonias also.
Right.
Then there can be, though it is more common in rheumatoid arthritis, some patients of SLE can have interstitial lung diseases, but that is not very, very common. Actually, it
Mm.
is very uncommon in lupus.
In
It is more
lupus.
common in other diseases like scleroderma or
Right.
rheumatoid arthritis. So if
Right.
that happens, patient can have prolonged cough or difficulty in breathing. So those things should be evaluated and that should be treated.
Okay. And in terms of something else I wanted to ask you. Um, okay. And typically, you said lupus is diagnosed at for young people, but is it always for young people, or some people can get lupus later as well?
Yeah, it is more common in young people,
Hmm.
especially in 15 to 45 years of age. But it is not like that it cannot affect other people. It
Right.
can affect any age. So even
Right.
children can have lupus. But
Hmm.
it is usually seen that if children has lupus, they usually have more severe disease than the adults.
Hmm.
And it can affect the elderly also. So no age is actually immune for lupus, but it is more common in the young people.
Right. Right. And does it, kind of, do you have scenarios where it can go into remission kind of on its own, or it doesn't? Lupus is not one of those diseases. Because some of these
Uh,
autoimmune diseases have this. thing, right? They go into remission and then people kind of assume that it was a diet they followed that caused it to happen or things like that. So,
Yeah, yeah. Sometimes it happen. Sometimes it happens, especially with say minor organ problems. Patient initially have some symptoms, then we started treatment, then they actually stopped it. Then, but again, that the spontaneous remission is not sustained actually.
right, right,
Even it patient goes into remission, then again usually after a few years usually it comes back, and
right.
usually sometimes it happens that it comes back actually more severely than the initial year. You see patients initially only has some joint pain, some
Mm,
fever, Na was positive, we started hydroxychloroquine. Patient actually after 1 or 2 years they stopped it. Then
mm,
after 3 4 years we see the patients in the ICU.
right.
So that's why it is very important that we should not actually neglect, ignore it.
Mm.
We
And
should not
also,
panic it.
should you, yeah, so I think on that, I think one of the things that we often find is people always want to know if they can stop the medication if they are in, if the disease seems to be under remission or under in control. So, they're not feeling the symptoms. So they
Yeah,
think the disease is gone and they want to stop the medication.
yeah. Actually, that is done by that always we do. When the
Mm,
disease is under remission, say usually by 2 years time, if the patient is remission for 2 years, usually we reduce all the medicines. Like steroid, we try to lower it as much as possible. If the
right,
patient is in remission for say another 3 years, so it is 5 years in remission. Again, we try to reduce some medicines. So that is a continuous process. When the
right,
patient is in remission for a long term, usually we try to cut down medicines as much as possible. One
right.
medicine we don't stop, we
Mm,
never stop. That is hydroxychloroquine.
mm,
All patients of SLE should always remember that all other medicines can be gradually reduced. They can be tried to stop also, seeing the scenario. But
mm.
one medicine we never stop, that is hydroxychloroquine.
Consequence.
Whether patient has minor problems, whether patient had major problems, the hydroxychloroquine should never be stopped,
Right,
because there has been many studies already has shown that if we stop hydroxychloroquine, disease will definitely come back, and patient can have more severe disease than the patient had before. So
right,
that medicine hydroxychloroquine is basically for lifelong,
right.
unless and only one. And during corona time people
Mm,
started actually
yes,
thinking, because there was some actually in the newspapers also that it causes cardiac toxicity or something like that.
right.
No, hydroxychloroquine is a very very safe drug, because probably those kind of side effects occurred because the dose used was high. Usually the dose we use is low. Usually we don't go beyond 5 milligram per kg. So
Mm,
most of the time it is 200 milligram or 300 milligram daily. So we don't go beyond that one. With that much of dose, even with long term, usually it does not causes cardiac toxicity. Only one precaution is needed when the
right,
patient is with hydroxychloroquine, that is regular checkup of eyes,
right,
because
right.
it can affect the eyes only.
Mm,
Otherwise, other you can read so many things. If you search in side effects of hydroxychloroquine in the internet, you can find so many side effects, but those are very very rare. So only thing we are concerned is the eyes. So
right,
when the patient is in long term hydroxychloroquine, periodically we have to do the eye checkup, and
right.
that is the only medicine that has to be taken lifelong. Other medications usually we try to taper it as much as possible.
Okay, thank you, thank you. One final question. Are there any limitations on fruits that lupus patients can have? Is there any fruit that they should not
No,
eat or?
no, there is no limitation with fruits. Unless the patient is diabetic,
Mm,
then only the limitation about the fruits
yeah, but that's
comes.
also the amount of fruit you eat. It's not,
Yeah,
there
yeah,
is
yeah,
no
yeah,
specific,
yeah, yeah.
yeah. Okay. Thank you, doctor. So any final tips for lupus patients and their families?
Yeah, I want to actually few tips, as I have already actually highlighted.
Mm,
First and foremost thing is, don't diagnose yourself.
right.
ANA positivity is not lupus. to be labeled as lupus, you have to have some other clinical features also. So consult a rheumatologist before diagnosing yourself as lupus based on anti-nuclear antibody. Number
Right.
one.
Right.
Number two, if you are told to be having lupus, don't panic.
Mm.
Everybody's lupus is different, and nowadays the outlook has changed.
Mm.
So most of the time, prognosis is very, very good. Now, as we have discussed, 15-year survival is more than 90%, and that quality of life is very, very good.
Mm.
So third thing is stress. Don't take too much of stress.
Right.
Stress can lead to problems. Then diet, you have should have a balanced diet. Regular exercise is very, very important. Smokers, they should stop because that will lead to more complications.
Mm.
Regular taking regular medications and regular follow-up, very,
Right.
very important. Don't talk to listen to others that I have taken this microphone for 6 months, I stopped, I am okay. It is
Mm.
not like that. Don't listen to the others. Always listen to your doctor only.
Right.
So what he decides, so you should consult with him, and always you can discuss your problems with your doctor. So don't
Mm.
decide yourself. You discuss with your doctor. Both of you can decide what is best for you.
Right.
And exercise I have mentioned. Only protection needed is the protection from the sunlight.
Mm.
So because sunlight can lead to flares, so that's why you should protect yourself from sunlight. So I always advise my patients to wear full sleeve clothes, try to use umbrella, try to
Mm.
use sunscreen lotions, and if
Mm.
possible, try to go to the outside in between when you have maximum ultraviolet rays. So say between 10 to 2. If that is not also possible, that is not strictly required. So you should protect yourself from sunlight. So those are the things I advise my patients.
Right. Thanks. Just on that, because you said, so one of the issues that happens sometimes if you have to avoid sunlight is vitamin D deficiency, right? So do you therefore, do lupus patients need to be, checking their vitamin D?
That is a very, very interesting question, actually. So,
Mm.
vitamin D actually has been, it is thought to be one of the vitamin D deficiency
Mm.
can be a cause of lupus. Then, vitamin D deficiency can lead to flare also.
Right.
So,
Right.
and nowadays, people are actually, most of the centers actually, they supplement their patients with vitamin D.
Okay. Okay.
Whether and it is always better to, if possible, you can check the vitamin D level, but
Mm.
usually most of our SLE patients nowadays we supplement with
With
vitamin
vitamin
D.
D.
Yeah.
Okay. Okay. Thank you. So thank you so much, Doctor, for answering all the questions. I think we covered a large gamut. And for some of you who've come in late, if you look at the early part, there was a question on vascular complications. We already covered that in the session. So if you go back to the recording, you will be able to see that. So thank you, doctor. We covered, as I said, a lot of ground. We talked of the various complications and how patients of lupus and their families should not panic and stay healthy and eat well and exercise also, but also stay in touch with your rheumatologist. I think it's a condition that needs close monitoring. So thank you so much, and thank you to Biocon for supporting this series on lupus for our lupus patients.
Thank you.
Thank you.